start? Sure. All right, so, actually, oh yes, there you go. Which one of those? I was just going left and right. Oh, okay. You ready to start? Sure. All right.
Dr. King,
Yes.
that thing, can we get a copy of your stuff? Is it there?
Can they get a copy of my slides? Both to talk to Lauren and Kenny. I have no problem with it, but sure. If it's okay, sure, I'll give you a copy. I'll try to set up the run Ustream, so I'm trying to get myself visualized here. But okay.
You should go to the Philippines, there's a lot of people there.
Excellent. Well, welcome everybody, and welcome back to FKC. And it's a pleasure being here. And for all you people out there in cyberspace as well, on Ustream, welcome. And we're doing a whole series here on joint disease. And we're going to call it the Bone and Joint Decade, because over the past 10 years, there's been a lot of advancements in knowledge known bone and joint disease, and we're going to share some of them here today. And what is some of the knowledge that we know, and what can we do, and what we cannot do in terms of treating a lot of the common ailments that occur in bone and joint disease, which stems anything from a young athlete exercising too much to older people with arthritic changes and everything in between. So basically the bone and joint disease, and why do we need a decade? Where are we now? Where are we going? And where should we be? We'll try to discuss those things, okay? So first of all, when it comes down to musculoskeletal conditions, which is bone, muscle, joint, here's some of the issues that we have. It's under-recognized, it's underappreciated, and it's underfunded. So from a traditional medical standpoint, there's not as much funding going into that as opposed to other things. There's still the stigmata that if you got bad joint or bone disease or back pain or things of that particular nature, you just need to suffer and take medication, and it's not as bad as some other things. But that's completely untrue, because people who have it are extremely suffering as well as many of the other ailments that we have. It affects 1 in 7 Americans here in the USA, and probably about 1 in 8 or 1 in 9 worldwide. It costs around $300 billion a year to our economy to treat patients with severe bone and joint disease. And our research is only about 2%, only 2% of the National Institute of Health is actually putting money into it. So the bottom line is, for people out there and for people here in the audience, we need to know that we need to take charge. We're not even expecting any breakthroughs with the pharmaceutical companies or anything like that, but there are things that we know that we can do, logic, lifestyle, eating changes, and supplementation that we know that can treat a lot of these ailments. And here we go. Remember the 20 extra years you added to your life, it tells them you can use them for healthy living? Well, here they are. Well, we don't want to end up like this gentleman over here. We want a longer life, we want a better quality of life, okay? So here's a gentleman who's obviously got severe musculoskeletal issues, and he maybe added a few years to his life, but I don't know if he's added or is lost or whatever. That's what it is. So we don't want to end up like that, okay? You know, from 1973 to 1983, we have declared a war on cancer. And it's true, President Bush Sr. signs the declaration back in 1990, and we did a war on cancer. And now we have a war in terms of osteoporosis and bones, and we're fighting that war currently at this point. Now, when we talk about issues and what's going on, osteoporosis or fractures are much higher prevalent. Look how many, almost 1 million here compared to 500,000 here, heart attack, stroke, and breast cancer. So more people are suffering from severe bone and joint disease, much more than probably all of the 3 combined. And yet very little money is spent into it, very little education is spent into it. And that's why we're here today, okay? So the Bone and Joint Decade endorsements are 60 countries back in 2006. And there is a lot now being done, which basically that's where I started talking about the Bone and Joint Decade, which started back in 2002, which is ending now in 2012. So there's been a lot of research, a lot of interest in it, and more interest. Okay. So what are the goals of the Bone and Joint Decade? We want to increase awareness, obviously. We want to empower the public. We want to increase research, and we want to improve diagnosis and treatment. And that's really the key thing. You know, in terms of treatment, the old treatments for bone and joint disease were essentially just old-time medications, steroids, anti-inflammatories, narcotics. And as we've discussed many times before, those only treat some of the symptoms, but actually do not improve the actual joint disease, okay? It's very important that we understand that. And now, you know, we have a lot of stuff going on. There's healthcare professionals, patients, public organizations. All the medical schools in the US, about 125, and all 50 states and many corporations are being involved in that, okay? Very important. So anyway, we just want to maximize all these things. We want to add value. We want to see collaborative activities. That's what we need to know there. Now, why am I telling you all this? It's really important because there's a lot of advocates for this. Washington, D.C., arthritis preventions, a lot of things that are going on in state initiatives. And the state initiatives are basically, the reason I'm telling you all this, are recommending supplementation as one of the mainstreams for bone and joint disease. And the supplementations include multivitamins, antioxidants, but particularly the things that we know, glucosamine, and a lot of other types of supplements that we know that have been proven for many, many years, not only here in the USA, but for hundreds of years elsewhere in the world, okay? Very important. And here's some dates that you should know that October 12th to October 20th is the same date every year, is when it's actually Bone and Joint Week, okay? So, a lot of stuff going on, and the reason I bring this all up basically is you understand that there's a lot of interest in it, and the interest from the traditional medical community as well as the non-traditional medical community is the advent and the adjunct of supplementation for bone and joint disease, okay? And here you go. Here's all these awareness that are coming out. They're coming in Time Magazine, coming Epidemic of Arthritis, Time Estrogen, Bones, It's Your Decade. Another reason actually is that many of the baby boomers now are really suffering tremendously from bone and joint disease. Many of them abuse their bodies younger doing extreme sports or maybe not doing enough sports or whatever it may be. So therefore, the decade, the people with the finances and the people who are the most productive in our society are the ones generally now are having severe bone and joint disease and cannot be as productive as they were in the past, okay? So again, public education is key, okay? So here we go. Glucosamine is the Tin Man's natural oil, and the evil witch says, forget the slippers, I want Tin Man's oil. So basically what that means is that we need some kind of a solution for our joints, and we do have them. There's no question about it, okay? So it keeps going back towards that, okay? There's a lot of research going on, okay? So here's some key things that I want to bring out. I'm going to make this very short and very simple to the point. Basically, glucosamine relieves joint pain, okay? It occurs in the body, natural, vital to normal cartilage function. I'm going to explain that in just a second. And researchers are also studying for making medicines, preventing blood clots and all these things. So let me just explain to you what happens in joint disease. When we talk about joint disease, it's very simple. A joint is an area between the two bones, okay? And there's usually a capsular space, and it's filled with a fluid cavity. This is a fluid cavity that keeps regenerating, that gets deteriorated, it keeps regenerating all the time. That fluid cavity consists of a lot of different things. There are fats, there's sugars, but one of the most important things is glucosamine, which is actually naturally producing sugar. And as we age and as we get older, our means of making effective and proper glucosamine or good quality glucosamine deteriorates. That in addition to other factors such as weakening of the bones, stress fracturations, a variety of different things, scarring, too much tension on the bones, weight, excess weight, all these type of things add more to the area there. And essentially, the old-time treatments, as I mentioned before, was what? Was steroids, anti-inflammatories, narcotics. And if that didn't work, then you go to joint replacements, joints, they used to inject steroids, whatever needs to be done. And again, all they would do actually is actually harm you more than good. So for the quick fix to get pain taken away right away, you can inject someone's knee, for example, with a large steroid injection, right? And that'll take care of the inflammation acutely, but will actually cause more harm. Steroids will deteriorate calcium, will deteriorate the bones. It'll break up the joint space. Number 3, once the steroid wears off, the bone that's rubbing against each other is going to get actually worse, because what's going to happen, pain, as I mentioned all the time before, is a mechanism for our body to tell us that something's wrong. Is that correct? So if we just relieve the pain and keep the problem that's giving us the pain going on, what's going to happen? When that medicine wears off, or whatever that would take away else, we're going to be worse off than we are, and that's the problem that's led to the problems that we have today, musculoskeletal problems, okay? So what we're finding basically is that things such as antioxidants, anti-inflammatories, natural ones such as curcumin found in JointAgain, a lot of the antioxidants, a lot of the multivitamins, a lot of they are cofactors in production of glucosamine. These are the ones that are very essential to actually heal the joint. So not only when you take a supplement are you actually decreasing the inflammation, but you're decreasing it naturally and adding lubricant to the joint. So as your pain is going away, the pain is going away not artificially, the pain is going away because of the healing of the joint. Does that make sense? And that's really the biggest difference out there. And you know, glucosamine and some of the other products that are in JointAgain and other things, bottom line with them, a lot of them are actually prescriptions in Europe and things like that. So we're lucky here in the USA, we can get them essentially over the counter and have the same potency and efficacy, okay? So it's really important to understand that. Here we go, here's JointAgain. And again, think of it as nutrition for your joints. Now, is glucosamine the arthritis cure? Does anyone know? Is glucosamine the arthritis cure? There was a famous book written not too long ago called The Arthritis Cure. It was based on glucosamine. And what it basically showed is that high doses of glucosamine and chondroitin and some other anti-inflammatory and antioxidant type materials, but essentially glucosamine, has been shown to treat and cure osteoarthritis. Not rheumatoid arthritis, but osteoarthritis. Now there's a difference. Rheumatoid arthritis is more of an autoimmune disease and affects usually the distal joints like the wrists and the fingers and the hands, where osteoarthritis is very common as we age and the bones start collapsing on one another. So there's a difference in mechanism. But is glucosamine the cure for arthritis? Well, there's books written on it, there's a lot of testimonial on it, there's a lot of research on it, and there's no question about it. Glucosamine has actually changed the face of how musculoskeletal disease is treated these days as a mainstream, okay? So it's very important. And why is it so important? Why is JointAgain so effective in terms of joint disease? Well, not only is it helping relieve the pain due to inflammation, but it's also actually healing the joint, and that's really the key thing. Will it work right away when you take it? Will you take any supplement? No, but usually within a few weeks, people see tremendous results. And we're talking about athletes, Marines, all the way to senior citizens. So it's not discriminatory upon anybody, because the same process that's deteriorating the joint can occur in a young person with inflammation or an older person with chronic inflammation, okay? So it's very important. So therefore, is glucosamine the arthritis cure? I think it is, and a lot of people do. And again, it's a natural fundamental component of cartilage in joints, and glucosamine declines with age, and there's been lots of studies in humans, rats, and just about every animal showing that increased production of glucosamine not only will actually take away the inflammation, but actually will heal many of the joints, okay? Vitamin C that we find. Why do we have vitamin C? Vitamin C is used for a lot of different things. The bottom line is here in JointAgain, we're using its antioxidant property and anti-inflammatory property. Vitamin C has a lot of cofactors and a lot of things fighting a lot of different things in terms of our immune system and things like that. But one of the properties of vitamin C in concentrations, of high concentrations, it's also a powerful antioxidant and anti-inflammatory. Curcumin over here is extremely important. It's derived from the Indian spice turmeric. I've talked about this before. And especially is a strong, strong anti-inflammatory and has been used in cooking, used in a lot of things. But concentrations of curcumin is extremely, extremely potent in terms of the anti-inflammatory effect. And then Boswellia. Boswellia is a very interesting compound. It's been around for many, many years. When something invades our body or our body becomes inflamed, what happens is we fight it off. And the way we fight off infections is we create our own inflammation. We create a local inflammatory area, a local inflammatory response, and that sets off signals in our body, in our immune system, to send those white cells, the macrophages, and all those cells essentially that we have in our cell line to basically fight off infections. So essentially, that's why whenever you have an infection or any kind of a problem, you'll get inflammation, you'll get redness, you'll get rubor, you'll get pain, you'll get inflammation, and that's actually the first sign of the healing process. We have to localize that area, okay? And one of the pathways that we bring in all these type of things is called the leukotrienes. And these are natural inflammatory cells that occur. So now, if you don't have an infection and the leukotriene setup is set up, you're going to get a lot of inflammation. And that's what happens in joint disease. So Boswellia actually inhibits the leukotrienes, and it has an extremely potent anti-inflammatory effect. Did everyone understand that concept there? It's kind of a little bit complex there, but not really. So the bottom line is, as you can see, just in that one product alone, we're using the gold standard of glucosamine, and of course high quality glucosamine, there's a lot of different types of glucosamine. We're using vitamin C, not only just as a vitamin, but as a powerful antioxidant and anti-inflammatory. Synergistically, we're using curcumin, which I think is extremely unique in our product, which is derived obviously from the Indian spice turmeric, which is an extremely potent anti-inflammatory on its own. And then in addition to that, we're adding Boswellia, because we know that the leukotriene pathway is the one that causes most of the inflammation, particularly in the joints, and we're inhibiting that. And then all of these actually work synergistically to give a very potent and safe effect. against joint disease and joint inflammation. And that's what we feel is extremely important. We don't know how they all work synergistically, but obviously the sum of all of them is much bigger than the parts individually. So they really are very synergistic, and we've had tremendous, great results with JointAgain based upon science, not fiction. Okay, so it's very, very important that we understand that, because once we understand that, then we can know in the future as things progress what we can do to treat other disorders by understanding the disorder and taking care of the problem. Okay, healing your joints. Just to give you an example, this would be a healthy joint space. Okay, a healthy joint space. This would be a diseased joint. You see all the calcification, the cartilage, the rubbing of the bone against the bone. That's typical diseased joint. Now, most people imagine this. You have a joint like this that's extremely painful, and you go to the doctor, they inject you with steroids, they give you a high doses of Motrin. What's going to happen? It's going to cost you a lot of money, right? The Motrin high doses can give you bleeding and other issues and ulcers, right? The problem's going to get worse because you're not going to have pain. You're going to keep walking on the area there, right? Okay. So what have you done? You've actually caused more harm than good. I know I keep repeating this again, but it's really important that people understand that. Now, does that mean you shouldn't take anything for pain? No, absolutely not. But if you took something natural that would actually take down the inflammation, Curcumin, Boswellia, so that'll decrease the pain, and then you actually add Glucosamine and some other products that'll actually increase that joint space. So you're doing two things at once. You're taking care of the inflammation, which is the pain, and you're also healing the joint. It's very simple, very, very simple. And again, here's just to give it a little bit more anatomy, because I want to make sure everyone understands it. Here's a typical joint space. You have a fluid in here, the synovial fluid. This is where the glucosamine would be, the cushioning. There's a capsule around it called a joint capsule. This would be the cartilage covering the bones, okay? And you can see this looks like a normal, healthy joint. In a damaged joint, there's two different things. We talked about arthritis. I just want to differentiate between osteoarthritis and rheumatoid arthritis. In osteoarthritis, it's actually the bones hitting against the bones. It's a degradation of the bones as we age or whatever the issue may be, and that's what's giving us the problem. In rheumatoid arthritis, we're just getting inflammation, autoimmune inflammation of the synovial fluid. Does that make sense? So there's a little bit of difference in function there. So even though they both have the arthritic term, the one that we're talking about specifically is osteoarthritis, which is probably more common, and that's where the healthy joint is like. Okay? Just give you an idea of that. There are other types of arthritic changes as well, but we're not going to go into that. And so again, what are some of the joint disease drugs? Very important that we understand. The standard ones now are aspirin, ibuprofen, steroids, Advil, and we all know that that's just temporary relief, but we're actually not taking care of the actual problem. Okay? And again, what's great about JointAgain? It is proven to be the winner in difficult joint pains. It differs from the store because it has curcumin, Boswellia, and other synergistic, potent, safe anti-inflammatory properties, which are proprietary to FKC, and makes it extremely unique, and again, all natural and safe and effective. Okay, and that's really the key. So again, weight control plus JointAgain. Frankly, the only way to ease your back pain would be for your rider to go on a diet. Okay, so this has his back pain. The pig's telling him that his riders should go on a diet, and it's true. A lot of extra weight, and we have a Slender Fusion and other products coming up, extra weight causes more stress and tear, not only in your heart and your liver and all that, but on your joints, no question about it. So there's a lot of dietary, exercise, things that we can do in moderation, that in addition to supplementation, that can really take care of our joints. And again, any product you get, you want to make sure that it comes from the labs that are GMP certified, which of course the FKC products are, and MSF certified, etc. That's really important. And I want to thank everybody for coming. I know it was a short lecture, but we just wanted to talk specifically about JointAgain and stress again the healing properties of it, and from a scientific standpoint, and also to differentiate it from other products out there on the market. Any questions? Thank you. Yes?
The leukotrienes, is there a component that is found in the bones, or how do you come up with that? I mean, how does you produce that?
Is there a component made in the bones for what? Yeah, you mean about glucosamine?
No, the leukotrienes, the one that...
Oh no, leukotrienes, no. Leukotrienes is, there are many pathways that produce inflammation in the body, okay? So for example, if you got a cut on your finger, for example, right? Automatically that area will become inflamed because as our body senses that something has been breached in our body, and there are different pathways that bring inflammatory cells to the area to contain the area, okay? Now, if you have an infection, it's a very good thing to have because you want to control the infection so that your natural immune cells can come and attack that area. Does that make sense? However, when you get inflammation due to, let's say, joints rubbing against one another, what's going to happen is your body doesn't know the difference. It looks at it as though maybe an infection because there's some kind of inflammation going on. So it's going to basically set off more inflammatory natural processes. Glucotrienes, for example, is one of the processes that causes inflammation. There's many others. So by blocking our natural aspects of doing inflammation, we can actually decrease inflammation. Again, that's one part of the whole picture. Does that make sense?
Yes.
And that's what that's about. That's the leukotrienes.
So you only get the leukotrienes when the infection is there and it just
Inflammation, or inflammation or some kind of breach, correct. And basically joint disease, you can have an infected joint, there's no question about it, but most of the early joint disease is inflammation. Wear and tear, bone rubbing against rowing, inflammation, and it's going to set up this whole reaction, leukotrienes being one of the pathways. There are many others, but one of the most significant ones. And Boswellia does a lot more than that, but that's one of the effects of Boswellia. I kind of shortened it, but just to give you an idea why the product is so unique. Yes? And one more question there, go ahead.
Okay,
Yes.
vitamin C.
Vitamin C,
Doesn't
yes.
that increase the production of collagen? Is that significant to?
Does vitamin C increase the production of collagen? It does, it does. But in this level, it's very hard to tell. Vitamin C most likely works in this particular substance in terms of an anti-inflammatory effect. But it does increase the production of collagen at much higher levels, yes. And it's used a lot in the skincare business and things like that. No question about it. Did I answer your question?
Yeah, I was just wondering if it does improve the condition of the joint.
I would say no. I would say no. Vitamin C alone, no. By itself. It probably helps, but I don't know how much significantly. So I think the combination of different synergistic properties is the one that really gives the relief. And we have not just testimonials, there's science behind it. So therefore, as far as we know, there are no side effects, and the effects are extremely potent in terms of joint inflammation. How much does it contribute to collagen formation and all these things? We really don't know, to be honest with you.
But there has been studies that have been put in some of the journals that arthritis is actually a form of infection.
Yeah, it is a form of infection. It depends on which one. For example, there are certain types of arthritises that are infectious. That is correct. And there are certain types that are autoimmune, and there are certain types like osteoarthritis, which are essentially just degradation of walls. There's different varieties of them. So depending on what type of arthritis you have, we're talking about bone and joint disease in general. So for example, glucosamine or JointAgain or any type of glucosamine may not be effective in people with rheumatoid arthritis. That's the point there, because that's an autoimmune disease. There are certain infective arthritic changes that can also give you joint inflammation and those things. And those type of arthritic changes need to be treated with anti-infectives as well as these type of things. But those are specialty things, and we're just talking about joint disease in general, but you are correct about that, yes. There's juvenile arthritis, there's a lot of different types, yes.
On the company DVD, the doctor that talks about the JointAgain is talking about how it has the right amount of vitamin C and how too much vitamin C can be harmful to the joint.
That's correct.
For example, like we take pretty much the range of products twice a day, but would there be any harm in throwing 1,000 milligrams of C with it? Is that going to get the balance off and affect the
No, it wouldn't take the balance. That's a good question. The question is if the balance is correct with the vitamin C. And if you take too much of vitamin C, you can actually have some detrimental effects, okay? The answer is yes and no, but the amount of vitamin C that you'd have to take to make detrimental effects would be taking probably a whole bottle. Does that make sense in one sitting? So the amount, yeah, so it's extreme. So that's more of a scientifical, how should I put it, observation, but not a clinical outcome, more of a scientific abstract type of numbers that basically, if you look at certain inflammatory numbers, there may be a change on, let's say, a lab inflammation on a very precise inflammatory number. However, clinically, that really doesn't make a difference unless you go to the real extremes. So I wouldn't worry about that. By taking other supplements with vitamin C, with that, it would not detrimentally affect. Yes, you can. No problems. Yes. That was a good question, though. Yes.
I have one more question after it.
Yes.
What I noticed from people that are using the JointAgain, right away they get a feedback that they got better from whatever the joint is. But if there's a muscle tissue that is affected, there is still that long term of things where they don't really get muscle pain? What is the effect on that? How do we explain that?
Well, I don't know exactly about the muscle. Everyone's a little bit different, but here's the catch. Okay, look, if you took everybody that took joint together and had joint pain, would everybody get treated? If everyone took joint together, would everyone feel relief? The answer is absolutely not. Okay, so the bottom line is you have to try it. Everyone's a little bit different. We know that JointAgain and Glucosamine and other products works very well against most of the common types of joint issues. On some people, it doesn't work at all. They may have something else. People have the same thing. For some reason, it doesn't work. We can't explain that. We just can't explain it. Their body may react a little bit differently. So not everyone's going to have the best result. And not only with supplements, but with medication too. Same thing with medication. Some people will do very well with a certain antibiotic or a certain pill for a stomach ulcers or whatever it is, and it'll do not well, even though statistically it's supposed to work. It will not work on certain people. We know that. So the bottom line is you just got to try it out. So the bottom line is you want to rule out any other serious illnesses, okay? If for example, someone has a diabetic neuropathy, or someone else, somebody else much more complicated, and you're saying, oh, just take JointAgain because your joint's the one that's inflamed. If there's more to it, that eventually will come out, right? And they'll have to be diagnosed with that, maybe needs further treatment. But for the general person who's having arthritic changes, they run, they have pain in their knees, they've taken aspirin, they take steroids, they take this and that. I think it's a great idea to start with JointAgain, you know, and see how you do. Most people do much better, and I've seen people from very old to very young do much better, and some people don't do better. That's just the way it is. That's just the name of the game, okay? Does that make sense? But the majority will win. And the bottom line from what I've seen from other products, I'm not going to make any names, I felt, and the JointAgain, from what I've seen, just my own personal feedback, seem to be more successful than the others. And looking at JointAgain, we have certain properties and certain things that we put in there that are different than the others, such as Curcumin, Boswellia, and other type things, which I think synergistically are much more effective than just the glucosamine chondroitin, etc. So that's why it's been very successful for many years now.
So what would you recommend for muscle pain?
Well, you know, muscle pain is a whole different story. It depends on what the muscle pain's from. I really can't make a judgment. It could be anything. It could be from a diabetic neuropathy. It could be from an infection. It could be it could be anything. However, a lot of it also has to do with weight. As I mentioned, people are extremely overweight. There's a lot of stress on the joints. That you're going to take JointAgain, they get a little bit better. But if they lost a little bit of weight, they do better. And this is the beauty behind it. There's a lot of people say, you know, I'm trying to lose weight, but I can't run. My joints hurt too much. Then they take JointAgain. They start moving more. Then they become more active. Then they lose weight. So it's a win-win cycle. Because without it, it's a losing cycle. We got to break that cycle somehow. Does that mean that their joint will come completely normal if they take JointAgain? Probably not, but it'll be much more improved that they'll be able to function properly. Does that make sense? And it's a natural product. The glucosamine and the other things are natural products that will basically fill in that synovial space and give you the fluid that you need when you were younger. Okay? Yes?
I've given JointAgain to quite a few people who are suffering from gout.
Gout, okay.
And somehow it relieves the pain. I don't know if it's the same mechanism as it does help the arthritic patients.
That's a very good point. You know, it's interesting because there have been a lot of medical studies, I'll just backtrack for a second, about glucosamine and the treatment for joints. And they basically came out that people with back pain or gouty pain and stuff like that, the glucosamine is not very effective. However, they do mention that certain people will have excellent results with it. So again, we don't know. But joints are joint. Joint spaces are joint spaces. They all work through the same mechanism, okay? So in theory, it should work on all the joints. Why does this work on knee joints and bigger joints better than others? I don't know. Nobody knows. However, within gout, I've also seen that people have gotten much better, and some people don't. So it depends on what it is. It may not be the only thing they need to take for gout. They may have to take their other prescriptive medication, but adding glucosamine can only help and not hurt. Good point. Any other questions? No? Yes.
People talk about collagen production and getting immediate results from JointAgain. Can you like megadose on the supplement? So
no, the immediate result that people are getting from JointAgain is a placebo effect. Okay, there's no way that you could take a pill and within a few hours or a day or two, that amount of glucosamine getting through your GI system and absorption rates and all that stuff actually be effective within a day or two. I'll be honest with you. However, if people do feel better, that's great. There is a placebo effect with all medications. I think it's 15 to 20% pills have a placebo effect if you give them just sugar pills, you know? So that's a good thing. But as long as they're feeling better, and then if they keep feeling better, they believe they feel better, and then in a few weeks when it really starts kicking in and they start running, that's perfect. So to answer your question, this thing about the cartilage thing and all that, those are extreme high doses, right? And feeling better right away within a couple of hours also, to be honest with you, has nothing to do with the JointAgain, in all fairness. But it doesn't hurt. Does that make sense from a science standpoint? People will shoot me for that and say, oh, no way, I've taken ice slower than 3 hours, I feel better. That's great. A lot of pain has to do with perception, okay? Very important.
That's taking 1 capsule or 2 capsules, but if you take 10 or 15.
No, you can't just take 10 or 15 at one time. No, you can't. It doesn't work that way, by the way. It's almost like when people get antibiotics. It amazes me today, if you write a prescription for someone with antibiotics they take for 10 days, first of all, people usually take it for 2 or 3 days, right? They never take the whole 10 days. That's number one. Number two, the ones that say, oh my God, I forgot everything. Then they take all the tablets in one day, and they think they're getting it just as effective. So a lot of it is education, in all fairness, and it's taking it on a regular basis consistently over time. And that's true with any supplement, just not just JointAgain. Any supplement, okay?
All right, so a previous diagram
Yes.
showed kind of bone kind of erosion or almost like damage. But if you take a supplement, will that damage be kind of cured or
Yes, the damage can be cured, or it can be definitely reduced, because what's happening is we're producing that glucosamine again. The glucosamine is the major sugar and component within the joint. So by doing that, can you cure it? No, you can decrease it tremendously. You'll decrease the bone, you'll increase the fluid in there, and theoretically over time, if the bones are not rubbing against the time, they will heal, yes.
Okay, so once the fluid's there, you get more space and the space
Correct,
is out.
correct.
Okay. What about the kind of cartilage itself? Can that regenerate itself?
A cartilage can regenerate to a point, and a lot of the components will just basically keep that, but essentially when you lose a lot of cartilage and bone, you're pretty much gone. But as long as you have a good fluid space in between there, and they're not rubbing, you should be just fine. Listen, we're not going to live forever, but as long as we can maintain as best as we can, that's really the key thing, okay? It's really important, yes?
How does this play into patients with replacements?
Oh, how does it play with replacements?
Yes.
Well, when replacements are done essentially when the person has exhausted all measures, okay? I'm not an orthopedic surgeon, but just in general, surgery and replacement is done to people who have basically end-stage disease. So to the point where nothing works. I mean, they can take as much JointAgain, they can take steroid injectors, they can do everything. They're basically essentially crippled, and their bones have eroded to the point where there is no repair. So then you have to seek the advice of obviously an orthopedic surgeon and a professional to know again. So it does not replace joint replacements. However, if you catch things early and you treat it early, you hopefully will prevent getting that joint replacement. Just like in heart disease. If you can stop, get your cholesterol low, get your hypertension under control when you're younger, you'll prevent having that bypass or angioplasty when you're 50, by just doing preventative measures. And that's exactly what we're talking about here. It's preventative measures. But there'll still be joint replacements and things like that. But probably less for people who really take care of themselves. Not just JointAgain, exercise, these type of things, dietary things, these measures.
Well,
Yes.
let me just tell you, I've only tried this to people, my patients also at the pharmacy. I tried this one, and I know it works for the most part.
We're talking about JointAgain.
The JointAgain,
Okay.
actually. But that not until I had my own accident did I know that it would. At first, I didn't think it was going to work because I flew off one time because I missed a step like this. I flew off real hard and hit my right hip.
Oh my.
And at the beginning, I didn't feel anything, but a couple of days later, I could hardly even sleep because I didn't know how to position. This was paralyzed.
Oh my.
And I didn't tell anybody, not even anybody at my house. And I started taking this, and at the beginning, I had the impression maybe it's not working.
Sure.
But now it's gone.
Is
The
it?
paralysis is gone.
Fantastic.
It's been like maybe 2 months. So it does work.
See?
On a slow pace, but it
Of
works.
course, nothing's magic, but it does work, and the science behind it is there. I mean, we're not saying anything new. There's books on glucosamine, there's books on Boswellia, so it's nothing new. It's just getting good products, synergistically working together that makes sense for your joint, that not only just through testimonials, through studies, that is effective in most people. So it makes a lot of sense, So, will it work on everybody? No. Will it work on most people? Yes. Will it work better than other products? I think so. I think so.
You talked about steroids and the side effects
Steroids,
of
yes.
steroid injections.
Oh, there's tremendous side effects, steroid injections.
But as a result, as a benefit to arthritis, you have a steroid injection, then it has some side effects. You talked about to joints itself. So how soon would that steroid injection have an effect on, say, your knee joints?
Oh no, one injection probably wouldn't do anything. It's chronic injections. Because people get a steroid injection, is that what you're trying to get at?
Right.
Yeah, essentially usually will require chronic injection. So if you require a steroid injection in your knee 1 month, probably 2 months later you'll be going back. It used to be for a time that people would be getting injections for years until it never
And
occurred.
that breaks down the bone?
Oh, it'll break down the bone, it'll increase your blood sugar, it'll decrease your immune response, it'll basically cuts out all your inflammatory response. And remember, we said that inflammatory response is a good thing when you get inflammation, infection, etc. So by doing that, you basically set yourself up for infections. So people on high-dose steroids are very susceptible to all types of infections, as well as other kind of issues. Yes?
On that same topic, what about the Boswellia and the JointAgain reducing the immune response?
Oh, that's a good point. That's a very good point. It doesn't really reduce the immune response because it's very specific towards leukotrienes only. And there's a lot of other inflammatory responses. Leukotrienes are probably the most harmful. By the way, that's how a lot of aspirins and Motrins, they work on certain pathways like the leukotrienes, etc. So similar to that, but naturally, and there are other pathways. So no. So in other words, it's not blocking out all your inflammation. So if you do have a problem, it's all that. Absolutely not. That's a very good question.
But
Yes.
I have a specific study on Boswellia actually, and I want to share with you. It has this COX-2 inhibitant property. So if you've heard of the product called Celebrex, which is a very expensive product used for arthritis, it's the same one. It has the same action. The only difference is Boswellia doesn't have the side effects that you get from the Celebrex. As a matter of fact, they've done separate studies on Boswellia on colitis because they thought maybe it would have the same effect as the Celebrex. And they found out actually that this Boswellia does a lot of good things to colitis. It actually cured a lot of the,
Yeah, there's a lot of studies on Boswellia. I'm not familiar with that study per se, but the bottom line, that's very interesting. But there's a lot of studies on Boswellia, not just for arthritis, for these things. Tremendous. Again, it comes down to natural products seem to work better than artificially man-made products. And we're learning more and more every day, even on omega-3s and all these type of things. So it's a very interesting point on that. And Boswellia is very effective.
I
Yes.
have a doctor actually at the hospital where I last worked who used Celebrex on a monthly basis, and I told him, you know, you're wasting your money.
Well, Celebrex is a very expensive drug. You're right. It works on a COX-2 inhibition, different thing. They've had a lot of issues with heart issues. Their competitors, the one that they took off, was it Celebrex?
Oh, I know what you're talking about,
Yeah.
by MSD.
Yeah. So there's a lot of issues with these type of drugs. Plus, they're very expensive. They cause bleeding, all these kind of things. So,
Vioxx.
that's right, Vioxx. So they had. We're not going to get into all that now. But the bottom line is that those pharmaceutical-made inhibitors have a lot of really bad side effects and are very expensive. So if you take something naturally that works as effectively, and again, it's a synergistic effect of what I mentioned all before, and we don't understand how it all works, but we know it works, and that's really the bottom line. So really, you just go out there, you have testimonials, you have people out there that are using it, it's safe, there's been no side effects. You try it, if you like it, it's great, continue on it. You shouldn't stop though, you gotta keep going, because then you get behind the ball again. So if you do well, then you stop, and you start exiting hurts, then you're behind the ball. So you just gotta keep it on a regular basis. Just like you would take your heart blood pressure medicine, diabetes, etc. But with that, I want to thank everybody. Thanks for the interesting questions, challenging questions. And we'll see you again in 2 weeks. Thank you. Thanks, FKC, for having me.
There's a lot of good stuff there. It was. And a lot of the curcumin, they're doing a lot of studies on the curcumin as well.
Yeah.
You know, not just in the Indian spices.
I'm still going to check on that comment that my clinical pharmacy manager did about the curcumin, about taking more than 1 gram per day.